Hello students, and welcome to Ethical and Legal Issues in Healthcare. In today's session we're talking about complementary medicine. Complementary medicine. Okay, well, what do we actually mean by complementary medicine? What does it actually cover? What's included in this new area of health practice? Well, I think we all have a bit of an idea of what we consider to be complementary and alternative medicine. It's really any treatment modality that doesn't fit into the biomedical approach. Complementary medicine, in terms of the ethical obligations related to the provision of CAM, they're no different really in essence to conventional medicine. Obligations for health professionals don't change depending upon the form of therapy. They don't change depending upon the treatment that's given. They don't change depending upon the modality of the procedure or the process or the treatment. Those ethical obligations remain the same. But I guess I'd pose this question at this point in time. Is there enough information in terms of the efficacy of treatment in complementary and alternative medicine? Is there some, is there enough research, enough literature, is there enough evidence-based science when it comes to complementary alternative medicine, or is this problematic in terms of meeting ethical obligations and in fact meeting legal obligations? Now, remember a few sessions ago we talked about complementary medicine, and we said in terms of the medicine itself, complementary medicine can either be listed or registered on the Therapeutic Goods Administration register, depending on their ingredients and the claims made for them. So most will actually be considered to be quite benign. They're considered to be low risk, and therefore they don't go through a process of evaluation for efficacy. However, depending upon the ingredients, because it is so varied, some medicines might well need to be looked at by the Therapeutic Goods Administration to actually see and to judge and to evaluate the efficacy of those particular products. There's very little case law, despite the increasing popularity and uptake of complementary or alternative medicine. I guess some of you might well have actually seen some recent media coverage of the Bondi Junction Clinic, where there was a young girl who was in fact having cosmetic surgery and died as a result of an incorrect dose of anaesthetic, I think it was, in that particular case. So the effect can be obviously just as devastating in terms of complementary procedures and processes and who actually undertakes those procedures. There was also the case not long ago of a young boy who was actually given, I think it was called slapping therapy, in a unit in Hurstville, and actually as a result of that died. And his parents were charged with negligence and recklessness, criminal charges in fact, as a result of that. So at this point in time, when we actually look at a deviation from that standard of care legally, we use the Bolam principle in the biomedical model. So we look at what a body of health professionals and what they would actually say in terms of the standard of care that's required to look after a patient or a client. Is there enough research in complementary and alternative medicine in terms of the body of knowledge that would go into informing whether there is in fact a breach of the standard? I'll leave you with that particular question. And thank you.